As we age, we often try and stop some telltale signs, maybe brown spots on our face, droopy eyelids. But one place we may neglect to look is our neck. So we are showing you a number of ways today that you can cure that turkey neck before it lands on your Thanksgiving menu. Sounds good, right? Dr. Ann-Therese Stubbs of Ann-Therese Aesthetic Medicine is here to share. Hi, Dr. Ann.
Hi, good to see you.
So is that skin on your neck really giving away your age? What does that kind of say about somebody?
Actually, the neck ages differently than the face, and I find that most women, when they hit about late 30s, maybe 40s, come into my office and they say, I hate my neck. What can I do about my neck? It's thinner skin, it tends to get sun damaged faster, and it does give your age away. You might take great care of your face, but your neck gives it away.
So some of those telltale signs that people would see would be the age spots, is that right?
Exactly, and then we get some banding, like just kind of some tight bands. You'll see a picture here. We lose the volume, so we get those little necklace lines too, the horizontal lines, and just kind of the crepey skin, or the skin texture tends to change, and it looks just a little wavier than maybe we'd like it to.
So let's talk about solutions. That is what we need to know. So first up, Botox and Dysport. So what are those and how can they treat our neck?
Well, as you see this picture right here, the vertical bands, the lines that go down, that's a muscle. And so as we age, that muscle gets bigger and bigger, and it tends to take the shorter distance between two lines, you know, from your chin right down to your collarbone there. And you can see the picture on the left, those bands are very tight. And once we relax those with just about 10 units of Botox or 30 units of Dysport, it just kind of softens the whole look. You see an after picture, and all of a sudden she has just a little more angle to her jawline there, back there, and she doesn't look like she's got the tense bands coming down. That's a muscle. We can relax it.
How long will those results last typically?
That usually lasts 3 to 4 months, and it's very affordable, somewhere in the $100 to $200 range. So it's not a permanent fix, but it is preventative in having those get worse.
And easy to do the maintenance on it if you want to keep it up.
In and out of the office in 5 minutes. Yep.
So another tool is Sculptra. How can we use this on our neck?
Well, we lose volume in our neck, and everybody hates those little vertical, people call them necklace lines, but I mean the horizontal lines, I'm sorry, and they just kind of make the neck look a little more crepey, and we've lost volume and collagen. So Sculptra is a collagen builder. It's a filler. We can use some of the hyaluronic acid fillers too, but the Sculptra actually builds your own collagen in those areas. So it rebuilds your collagen and smooths those lines.
Now, you mentioned crepey skin as we know it, and there's something else that you say can help this, and I actually never heard of this, Fraxel. So what is this?
Yes, Fraxel is a wonderful laser that fractionates the laser beam. So anytime you put deep heat down into skin, especially the neck skin, it will build its own collagen. So you can see a picture here. Fraxel does a couple things. It takes pigment off, and it also thickens the skin. So when we get those brown spots and just the unpleasant kind of crepiness as we talked about, we do one Fraxel treatment each month for a series of 4, and people usually get the results as above. Just the pigment goes, the skin thickens, it looks like more youthful skin because your own body goes into high collagen producing mode and builds that collagen that we've lost over time.
Now, there are also a few non-surgical approaches that you offer, so we're going to go through 3 of these. Cool Mini, Kybella, and a laser neck lift. So what are each of these tools good for?
A lot of people don't like their neck because they have some fullness or extra fat pad there, and you'll see in this picture here from a profile, this young lady had just a little fullness, probably very genetic, meaning she got that from Aunt Sally or something. But basically we can do an injection called Kybella that melts the fat cells or kind of bursts them open and your body naturally clears them, or we can put that into a little cool sculpting handpiece called the Cool Mini. That little fat pad gets kind of between 2 very cold plates, and the fat cells get frozen, and then over the next month or 2 your own body clears those fat cells that have been broken open by the cold. And both the Kybella and the Cool Mini are pretty non-invasive. Cool Mini, no needles at all, just a little handpiece that squeezes the area and freezes it for an hour. And then the Kybella is 5 minutes of little tiny injections there. People do have a little swelling with the Kybella for maybe a day or 2, and it feels a little numb, but all of that tends to be very tolerable compared to the result.
All right, Dr. Ann, as always, free consultation so you can get folks in, decide what they want to do. You also have a great deal on all these neck and chest treatments.
Exactly. It's winter time right now. We all have time to kind of address something with a laser or something that might take a little time with a turtleneck, so it's 20% off anything that someone would need to kind of address the aging skin on the neck and the chest.
Sounds perfect. I want to thank you, Dr. Ann, as always.
Thanks for having me.